Dr. Jackie Gardner-Nix here, doing another blog, and it's April the 4th, 2020. I'm in Port Hope, Ontario, Canada. And my specialty as a physician has been mindfulness in the arena of chronic pain, but chronic stress is also part of that. Today's topic is going to be on the window of tolerance, which is incredibly relevant to these COVID times. And it's a concept which is quite simple. The window of tolerance. It's really what we inhabit, hopefully most of the time, when we feel like we are managing what we need to manage, when we feel like we are coping and coping optimally. But the window of tolerance can be exceeded, and I think in these times we have more chance of it being exceeded. We can go outside our window of tolerance. I should acknowledge, by the way, that this is a concept that was introduced by Dan Siegel, who's very well known in the mindfulness world and has written many books. And in a moment, I can show you a diagram of the window of tolerance. But effectively, when we are feeling overwhelmed, when we are feeling hyper aroused, meaning that our brain is agitated, our body is feeling it, then we are outside our window of tolerance. And sometimes we are not in the frame of mind to figure out how to get back inside it. We don't have to rush back either. We can actually just observe where we are at the time and figure it out slowly as to how we can get back into that comfort zone again, if it feels comfortable at all at these times. We can also go down. So we can be outside our window of tolerance by feeling down, by feeling closed off, closed in, hyporeactive. Just a really difficult set of emotions that feel like we have closed in. That's hypo-arousal. And of course, our brain neurotransmitters are kind of affecting all this in the way we feel, the emotions we have, and the bodily outcomes of that as well. Because, for example, when we're feeling hyper-aroused, our sympathetic nervous system, which is responsible for the outpouring of adrenaline and cortisol, the sympathetic nervous system is on overdrive, and we might notice it in a faster heart rate, in some rapid breathing, and so on, sometimes in trembling as well. So that's where that sort of comes from in our bodies and minds. And it affects us throughout. It may start in the mind, but then it goes through the body. And in hypoarousal, similar, but a different probably mix of brain neurotransmitters or neurochemicals. And so it's always a challenge to first recognize it, and second, be able to bring ourselves back into our window. And I'll show you that diagram right now, as it's kind of interesting. And so this diagram shows you your window of tolerance. And although it says how trauma can affect your window of tolerance, really any stressful event can do so. And so for our frontline workers, those who are going to work and putting themselves at risk, they may be in hyper-arousal quite frequently. And as you can see from this, it can be anxiety, it can be anger, a feeling of being overwhelmed and out of control. The body might feel like it needs to fight or run away. And it's not something that they choose or we choose when we're in that state ourselves. It's something that just seems to take over. And then the opposite, where we may feel zoned out, which is at the bottom of the diagram, sort of numb and frozen in our bodies, wanting to kind of shut down. Again, not something we choose. And so how can we step back into our window of tolerance How can we deal with whatever is coming up? We might be in the supermarket checking people out and have a difficult time and feeling sort of on the verge of tears as we see a group of people maybe chatting away too close together and loitering so we can't get more people into the store. Or we might be in the ER at the local hospital and finding there's just too many people to look after. And so how does this all play out? Well, taking a few moments, perhaps, this might be the time to ask your supervisor to go to the bathroom. Can I please just leave the floor for right now? We'd noticed over time in our mindfulness groups that tended to be what people did when they felt they needed to get out of the room. It would be the bathroom break, the restroom break. But there are other things, just even leaving the room but understanding why, just getting out of the heat, as we used to say colloquially. And sometimes it's a different route. It's going for a walk, which may not be possible when you're in the heat of work and dealing with a lot of emergencies or a lot of work to do. And for those of us who are at home, and some unable to work even from home because their jobs just don't lend themselves to that, it may be needing to get out into the backyard or wherever there's some quiet space, keeping that social and physical distancing going. Sometimes for me, it's cooking. It's just going and doing some baking will bring me back within my window of tolerance, or watching a favorite TV program, or having a visit through the screen with my grandchildren. Hearing my 7-year-old granddaughter read in French and realizing that she can now read, which is just wonderful to watch. So those are the kinds of things we can do. And we can also perhaps go to our breath if we are schooled at that with mindfulness practice, just taking a few breaths, just noticing where we are in this present moment. And it just may be a 45-second just time out in order to get back into our windows of tolerance. That's all we may have. But there is a first aid meditation that we've offered many of our pain sufferers. And sometimes they do this quick little formal practice several times a day when they feel like they're having a difficult day. And I can share that with you. So just taking a few moments, probably about 4 or 5 minutes. So it can be very helpful to have formal practice, meditation, as a first aid tool to use whenever we experience stress, when challenging situations arise. Such times as being in the front line as an essential service worker. And sometimes it may be because we feel closed in, unable to do the job we were doing. A feeling of not being able to go out freely. And that may feel very difficult. Awareness of the breath in these situations can be very helpful and is so familiar to us once we start to practice meditation. The breath being our focus for many of us, that brings us into the present moment awareness. Just an awareness of being present right here, right now. And the breath does change when we're stressed. Sometimes it can become too rapid, sometimes too deep, and for some too shallow. And just bringing our attention to the breath. just noticing its pattern, its depth, its frequency. Nothing else mattering right now. Not needing to be in the future or the past, or to be judging anything in particular, but just working with the breath to bring it to a comfortable level, to the level that feels normal for you. Just breathing, slowing it down if it became too rapid, speeding it up if we had been holding our breath in the tension of the moment. Just remembering to breathe and just being present. And if feelings of frustration, anger, shame, disappointment had been part of how we were outside our window of tolerance, just noticing that everything passes, everything changes in its intensity. Feelings can soften. Noticing if our hands are clenching, our jaw is clenching, our foreheads furrowing, a frown on our face. Not needing to change that, but just be authentic, just being authentic. Those emotions are valid and they pass. Breathing, knowing that we have value, knowing that our feelings are important to check in with, knowing that we're important to ourselves and to others. Everyone has value. And if there is a feeling of having difficulty with that, we can be checking in to see when that was installed that we didn't have value, because we do. And however we came to feel that way in the past was installed in a way that might have been unkind and clumsy. And those people that we got that message from may have had their own difficulties and challenges. But we can be our own evaluator. And we can feel good about ourselves and begin to really increase that skill of knowing that. Improving in valuing ourselves well and appropriately far into our future. And our breath will remind us. So just remembering our window of tolerance and what we can do about it.